Hi, I am Dr. Shyamala G, Professor and Unit Chief in the Department of Obstetrics and Gynecology, also Course Director, Fellowship in Gynecologic Oncology at Kasturba Medical College and Hospital, Manipal. Let us learn about HPV vaccine and its importance. HPV vaccine is a vaccine, a preventable vaccine with the purpose of preventing HPV-related cancers, mainly cervical cancer. It also prevents other HPV-related cancers such as vaginal cancer, vulval cancer, penile cancer, oral cancer. So it also has preventive role among males as well as females. What is HPV vaccine? HPV vaccine is made of viral-like particles from the HPV virus. It doesn't actually contain viral DNA or any of the viral main components. It just contains the viral particles. So it cannot cause viral infection, neither cancer, just because of the vaccine. So it is just the virus-like particles which is injected that induces immunity in the individual so that it prevents infection with HPV virus later on. HPV vaccination should be given to individuals when they are young, before being exposed to the virus. 80% of the individuals will get the HPV infection during their lifespan, but it is after the age of adolescence and beyond. It's always better to give the vaccine before they are exposed to this HPV virus. And also the early giving of the vaccination helps in another way, that is, the younger people have higher immunogenicity. So when you give the vaccine to the young children, the immunogenicity is robust, so the protection is higher. So the primary group that requires HPV vaccination is the age group of 9 and 15 years, mainly the females. Also it is recommended for boys, as I told already. It prevents penile cancer, also it prevents certain genital warts and oral cancer. HPV vaccine is supposed to reduce the HPV infection by 80 to 90%, cervical precancer by 40 to 60%, and the immunity obtained is long-lasting. It is proven even beyond 15 years, they retain the same immunological status, immune response. One thing that everyone should remember, vaccine is the first level of prevention. It is like the gatekeeper, which prevents the HPV from getting into the body. But though you are vaccinated, you are supposed to go for cervical screening as per the protocol from the age of 25 years. Cervical screening has to continue despite you being vaccinated. Globally, there are a lot of initiatives for HPV vaccination. In India and in the developing countries, it is mainly focused on prevention of cervical cancer, and vaccine is recommended for girls between the age of 9 to 13 years and even beyond that up to the age of 26 years, as we already discussed. WHO has taken the initiative of covering about 90% of eligible girls with HPV vaccination by 2030. And we all have to work in those lines. All of us have to understand the importance of this vaccine so that our next generation is free of cervical cancer. The goal of everyone has to be elimination of cervical cancer, and our young generation should never see this cervical cancer, which is one of the major health burden in the developing countries. Thank you.